Good evening, good morning, good afternoon. Thank you so much for joining us. My name is Jennifer Tierney, and I'm the Executive Director for MSF here in Australia. We're here tonight because on August 4th, an explosion that shocked the world ripped through the heart of Beirut. It took hundreds of lives, it injured 6,000 people, permanently disabling many of those injured, and left hundreds of thousands of people homeless. All of this while COVID-19 infection rates were steadily tracking upwards in Beirut and an economic crisis engulfed the country. Here in Australia, our hearts were broken at the sight of this destruction and the terrible impact that this explosion had on Beirut. For any of us who have walked the streets in central Beirut through Jamese or Hamra, we know just the warmth of the people there, the incredible vibrancy of the neighborhoods that were struck, and our hearts were broken. For the 200 or so people of Lebanese descent living in Australia, I just want to say we want to acknowledge your pain and your hurt, particularly over these last weeks. We're here today to share MSF's perspective and talk to you about the work in the face of this crisis. MSF history in Lebanon spans my whole lifetime, actually, from 1976 until today. In 76, we went in to provide assistance in response to the Civil War, and that was actually the first war zone that MSF had ever worked in. So today, MSF is providing free medical care in various locations with over 600 staff members throughout Lebanon. We're fortunate enough to have Jahan Baseso, the General Director of MSF Lebanon Branch Office, to help us paint a picture of what our response is and what's happening in Beirut. Jahan, thank you for spending this time with us. We really appreciate it. Could you just first tell us about yourself and the situation now?
Okay, so thank you, Jennifer, and thank you for having me to talk about Beirut. I think it's really important that we keep talking about Beirut, although, as we know, the media cycle has almost already moved on. I've been in Jordan since the beginning because of COVID, but the blast, I can definitely say that the impact of the blast psychologically even has touched the entire region. One of my colleagues yesterday was describing it as a war in a minute. And I think for generations that have experienced war and crisis after crisis in Lebanon, this blast really shook them to the core. And as you mentioned, MSF and Lebanon have a long story and go back a long way. So once again, we find ourselves alongside communities trying to pick up the pieces.
Can you paint a picture for people watching today about what happened, in the first moments or the first, and how MSF has actually mobilized, responded, or the struggles that we've actually had?
On the 4th of August, a massive blast it left many people wounded, thousands of people wounded. It killed so far 200 people. Many people are still under the rubble. The estimate is around 30. I can definitely say that people have heard this blast all over Lebanon, even those in the mountains. Some of our team members were not even in Beirut, and they could hear the sound. In our MSF premises, our offices have sustained minimal damage, but many homes of our colleagues, actually including my own home, had broken glass and several broken doors and needing really rehabilitation. 300,000 people have been left homeless. This is an incredible number to think about in a country where 1 in 4 is a refugee since 2000 estimates. And you have already Palestinian refugees on top of Syrian refugees and a sizable migrant worker community that is already stretched and already suffering in Lebanon. The first impact of the blast is maybe visual. There were so many images circulating online of a Beirut destroyed. And unfortunately, for those of us who live and visit this city and this country, images of destruction never really left the city. There are many, till today, buildings that remind us that Lebanon and Beirut had a violent and very unpredictable past, where unrest can happen in a minute. MSF teams quickly mobilized, some of them volunteered. We have even our own teams because they make up the community, they volunteered in cleanup and rehabilitation efforts. As an organization, we first responded by giving some donations to civil defense, to Red Cross, wounded, flooded the hospitals, around 6,000 wounded in the first 12 hours. You have to keep in mind, Jennifer, that some hospitals were even hit by the blast. Two main hospitals, Mustashfa Room and Mustashfa Jaitawi, which are main hospitals in Beirut, were really severely impacted. This means that a health system in minutes was stretched and overwhelmed.
I mean, that health system was stretched and overwhelmed before the blast as well. Can you talk about what MSF was doing with those 600 employees before the blast even happened?
Sure. So we said 1976, Lebanon was MSF's first conflict zone, but actually from 2008 till now, till 2020, MSF has been continuously present in the country. We are working in the north, south of the country. We're working in Beirut. Our teams address many different medical issues, including sexual reproductive health. In Zahle Hospital, we provide actually a very important and special treatment in what is a pediatric ICU. And we treat thalassemia patients. We work in refugee camps. MSF provides care to patients suffering from non-communicable chronic diseases, including diabetes. In Barelias, you can get also surgery, elective surgery. So MSF was already all over the country. It's around 150,000 consultations a year. That's the estimate, and it's not a small number in a small country. So our teams were already mobilized in all those different locations. And in Beirut, we work in the south of Beirut, in Shatila Palestinian Refugee Camp, Burj al-Barajne Refugee Camp, and we run a maternity there. So, and in addition to everything, I cannot forget mental health. And actually, mental health was MSF's entry point. In 2008, when MSF came to Lebanon to establish mid to long-term projects, mental health was one of the main needs that popped up.
And how is that experience with mental health relevant today to the, to Beirut post the blast?
In the few days after the blast, our social workers from the different projects were already on the streets of Beirut providing psychological first aid, sorry. And there are generations in Lebanon who have experienced war, who have experienced political unrest. If I can just share a personal anecdote, even my own mother was in Beirut in the 80s, and even watching a mediated experience from a distance, so watching Beirut again destroyed, touches generations that are not even physically in Lebanon. So I can only imagine what it's like for generations of Lebanese to see their country once again destroyed. And from a mental health point of view, this is really, really challenging and really catastrophic. As MSF, our staff are also among the first populations we try to address mental health needs with, because as I said, they're part of the community and they are not immune from the stresses and the challenges, the mental health challenges that are very real.
You also mentioned our experiences with non-communicable diseases. I remember just post-Hurricane Sandy in New York, where everything absolutely shut down. People were often cut off from the medications that they needed, particularly those who were in poor, more neglected neighborhoods. Is MSF finding that in Beirut as well?
Absolutely, and Jennifer, we're working in two main ways. In some places like Karantina, Bush Hamoud, and for people that know Beirut, it's a small city and these are dense areas. We are balancing between finding a way for people to come to us through establishing medical points and also doing home visits. Because many of the patients that you mentioned that would need for continuity of care medication, like diabetes medication, like blood pressure medication. So these are medications, if they are interrupted, they could cause serious damage. So you can think of it as critical care for non-critical patients. It's very normal when something like this happens that the focus is on the wounded, the focus is on those bleeding, and that kind of takes up and consumes a lot of the health system. But patients who need chronic medication and who need continuity of care for the variety of the things that they might be experiencing, it's just as important. So it's still critical care, even if they're non-critical patients.
Absolutely. And you've talked about, you and I have chatted a little bit about that day, but prior to that, you've described this crisis as a crisis within a crisis within a crisis. What is it that you've been dealing with over the last year in Beirut? And I mean, how does a country have, I don't want to use the word that on the citizens to have to be able to constantly rise to these crises. But how is the country moving through that? It's completely incredible.
So protests started in October last year, and you saw hundreds and thousands and even thousands of people flock to the main squares in Beirut, requesting reform, requesting change, requesting sometimes basics like electricity and a clean access to water, and that kind of we had curfew, we had a lot of different kind of interruptions to daily life, and it was also culminating in what became a freefall, an economic freefall, a crash. Basic goods became prohibitive and expensive for way too many people. I read that kind of the middle class in Beirut, those who could just get by, are now no longer able to get by, and that can. There were limits imposed on, and there still are limits imposed on withdrawals of banks. The private and public healthcare system in Beirut, which was already quite strained, became very, very strained, and there was a lot of pressure. People who could afford to access private healthcare previously could no longer, and this really culminated in protests, and many people were even injured in protests between October and December, January. And then, like the rest of the world, we were all hit by COVID. Fortunately, in the first period, I can say from maybe March to June, Lebanon managed to control the spread of COVID, and the numbers were quite low compared to other much more hit areas in the rest of the region. But it's been very clear that social distancing in a place like Shatila refugee camp is an illusion. It's not it's not possible. So our teams were really focusing more on infection prevention control, health promotion measures, hygiene measures. And then after the blast, it's still not clear whether the spike in COVID cases is linked to kind of the gatherings, whether funerals, whether to rebuild homes that happened after the blast. But the reality is that today, Lebanon is experiencing a huge spike. And as we sit here now, there's a lockdown, which means there's a lockdown while people are rebuilding their homes and while they are struggling to make ends meet. Many of those ends meet are linked to health and humanitarian basic needs. And that's what MSF is trying to focus on through its response.
We've mentioned we have 600 team members working throughout Lebanon. How are they coping? And what you mentioned to me earlier that they're engaged quite deeply in their own communities. Can you talk a bit about that?
Yes. So there is the duality when you come from an area that's been affected by so many crises, as we said, crisis within a crisis, political unrest, economic unrest, COVID, and a blast. Our staff are responders in their communities, but they are also fathers, mothers, sisters, citizens, so they're going probably through like a roller coaster of feelings, and they're struggling between balancing what would be considered professional needs and personal needs. And I like to think of MSF that as an organization that meets its people halfway and that realizes this pressure on our staff. And I can definitely say that people are working beyond and whenever, but what I also know, and this is to say something positive, I also know that people feel good when they can work. And for many of our staff, being part of MSF's teams means being a part of something that's changing, something that's contributing positively in a situation that is otherwise static and stuck. So that's definitely what I get from our staff and our teams.
What are some of the barriers to getting the work done that the staff are talking about? I mean, obviously there's infrastructure, are you able to get a hold of medical materials that you need? I mean, that was difficult when COVID was happening for MSF around the world. We were having huge ruptures in supplies. What are you all seeing there now?
like others, we are facing difficulties in getting medicine into the country. This is currently something that MSF is going to be trying to work to address, because we have some shortages in the country in general in some basic equipment. But for now, we are able to secure everything where we can locally. But like all over the world, there were some shortages in masks, some hike in prices of PPE, and an unstable but very much alive black market economy. So there was always a little bit of a need to make sure that we have what we need for the project and for the medical humanitarian activities that MSF is running. Another challenge I can say is traditional aid systems many times focus or design assistance based on nationalities, not needs.
Yes.
In Lebanon, you will find certain packages of care depending on when you arrived in the country as a refugee. So, and depending on which institution is responsible in the system for your well-being. And as MSF, since we don't discriminate on nationality in our projects, and our projects are open for all, whether they are Ethiopian migrant, Syrian refugee that just arrived, Palestinian refugee that has been there for more than 60 years. So that's definitely an issue that MSF tries to address by making sure its assistance is open to all.
So, I mean, the assistance that we're providing, I always say we don't ask at the door what your nationality, your religion is. I mean, it's very much based on medical ethics, right? And it's across the board, across the world, just to be clear. There are a lot of people out there who are interested in supporting Lebanon now. How can they do that? I mean, what are some of the activities that you might recommend someone does to stay involved and show that they care?
I think a few things. First of all, the community mobilization, the Lebanese community mobilization, both from the diaspora through channeling financial support and even expertise through borders. So we had even some consultations happen online, as far as I'm aware. With Lebanese diaspora, I was contacted, and MSF was contacted by, for example, Lebanese medical professionals based in the US who were wondering how to be of help through online consultations and things like that. I must really highlight that there are so many worthwhile and relevant local initiatives of people helping each other from the communities. The media sometimes tends to focus with a little bit of a surprise about when they see this kind of mobilization, this kind of community solidarity. I find nothing surprising about this at all. And it's just incredible to see. There are people, a lot of support has gone to the Lebanese Red Cross, but there are a lot of other organizations. Unfortunately, today we are not able, for technical reasons, administrative reasons, to fundraise in Lebanon or even channel funding through it. But I strongly encourage people to support MSF's emergency envelope, because through that envelope, we're able to, give aid to where it's needed as an organization.
Yeah, I think just to put the point across too, that MSF globally is crises upon crises. So having flexible funding at this point allows us to direct that. I feel like we're putting holes in the dam at times. And so having the flexibility of funding doesn't mean we care any less about the crisis in Beirut. It just means that we can be flexible with our response teams so that they can do what they need to do. You mentioned the media before. We're in an insane media cycle. My background is communications, your background is communications. I mean, the speed at which we're turning over from our attention from one story to the next is, I'll use the word of 2020, unprecedented. How has that felt in Beirut? I mean, how are you seeing that manifested in response to the crisis in Beirut?
That's a really good question. And I think, the media cycle, as you know, it's just churning out headline after headline, and most people have, before COVID fatigue, we heard of refugee fatigue, and I find this really disheartening. But I think it's also very important to continue to find ways, because to get people to really see what's going on on the ground, and I think that's why MSF's witnessing, I believe, is quite important, and also creating platforms where voices from the community can really explain and say what they see. right now, as we hit the 1 month mark next week, media is probably already dusting off this topic in our region. So in the media we consume here, media is once again focusing on politics, and health and humanitarian and assistance issues tend to take a back seat. What I would definitely say is that now more than before, health and humanitarian needs need to continue to take space and not be an afterthought, because as the cameras might move on, but the humanitarian needs don't, and the people that really need assistance, what we call the vulnerable of the vulnerable, the most vulnerable of the most vulnerable, will be the ones that are left behind.
Let me ask you, who in Lebanon are the most vulnerable of the most vulnerable in your mind today?
Okay, so that's a tricky question, because I can quickly answer with some nationalities. As I said, 1 in 4 in Lebanon are refugees. But what I can say, and what I believe is the duty of MSF as an organization that I belong to, that does needs assessments, is to continuously revisit this in such a setting where it's continuously in flux. The vulnerable of the most vulnerable of yesterday are different from the most vulnerable of the most vulnerable of today, you know, and the aid system may have reached pockets of individuals that now no longer need the assistance that is given to them, and we need to move on. But what I can definitely say is that it should not discriminate based on needs or pre-assumptions.
That's an excellent point, and a really good illustration of how important it is to be vigilant about the ever-evolving situation wherever we are, in whichever context that we are. Speaking of media and communications and making sure that the most vulnerable of the vulnerable are being featured, how does MSF, how does MSF in Beirut continue to get its message out about what's happening there? And I just want to thank everyone online tonight for spending some time listening to us talk about this. But what are some other ways that people can be getting their information?
So we have right now we're working a lot on social media, as everybody is. So we have MSF Lebanon Facebook channels, MSF Lebanon Twitter and Instagram. These are some of the ways where we try to reach, but we also balance with online and offline presence, because many of the word that we need to get out is not just across borders, but also sometimes in the community. So we're always trying to make sure that what we're doing is clear and understandable, first and foremost to the communities where we are, and then online through all these different ways.
How do you get cut through in moments like this? It's got to be incredibly difficult to get your messages heard by those who can actually make change.
I think that again, this is a very difficult question, and I don't know the answer, to be very honest. And it's hard when you're living and working in a context like Lebanon. What does change look like? We are reading texts written in the 18th century that sometimes describe what we are seeing today. 10, 15 years ago, there was another wave of protests, before that civil war. So all I can say is that obviously the Lebanese have not given up. An organization like MSF does not have the luxury of giving up on a context like this. And we need to keep reinventing ways of being useful, of being relevant. Sometimes the role of MSF in a community like this one and in a response like this one is just to hold the door open for those actors who may need some means in order to reach certain populations. So, and it's not, for example, what we were able to do in 1976 during the Civil War, or 2006 during the war as well with Israel. But so we need to keep reassessing where is the added value for MSF.
So we decided together before we started this conversation that we were going to keep it short and sweet for everybody. But is there anything that I'll ask an open question. So is there anything that you want to say or points you want to make that I haven't asked you yet?
I think, well, you asked a lot of important questions. I just want to say that to bring in the point that those that need the most assistance are often not on camera. They are often sidelined by communities even before major events like this one. And their suffering is just magnified. And for me, that's where MSF is And that's where MSF can be, especially because our funds are independent, and especially because we don't take money from governments. So, and we're not linked to donor restrictions and this grant and that grant. So that's where I urge people to think of those people off camera and offline, because there are way too many and they need a lot of help.
Absolutely. That goes for every place in which we work right now. Thank you so much. I will say, you know, it's Beirut is an incredibly special place. I had the privilege of working with MSF there for a short time in about 2012. To see what's happened has been devastating. Knowing that you and the rest of the MSF team are there is one small light in a really incredibly challenging time. So I guess we'll say from everyone here in Australia, keep your chin up. Call us if you need anything.
Thank you, Jennifer. Thank you for this, and thank you for talking about Beirut and focusing on it.
Thank you very much. I appreciate it. And thank you to everyone who joined us for this conversation this evening. We appreciate it.
Absolutely.
Thank you.